Good evening, everyone, and thank you so much for joining us for tonight's panel discussion on COVID-19 vaccination. My name is Wanda Willis, and I'm the Director of Community Engagement and Inclusion at the Cummer Museum of Art and Gardens. The Cummer Museum, in partnership with the American Alliance of Museums, supports Communities for Immunity, an initiative designed to support the work of museums in engaging their communities in COVID-19 vaccine confidence. So tonight we are proud to have on our panel healthcare professionals from Baptist Health, UF Health, St. Vincent's, Care Partners Clinical Research, and the Mayo Clinic. So before we get started on our discussion, I would first like to take the opportunity for each of our panelists to introduce themselves, let us know what institution where they serve, and to talk a little bit of why COVID-19 education is important to them. So we're going to kick off and we'll start with Chad from UF Health.
Hi, good evening, everyone. My name is Chad Nielsen. I'm the Director of Accreditation and Infection Prevention from UF Health Jacksonville. In my side job, when I have free time, I'm also a public health officer with the Florida Air National Guard, where I also do infectious disease epidemiology here in the state of Florida.
Thank you so much, Chad. Thank you for joining us this evening. And Dr. Shalika Katsuba from Mayo Clinic.
Yes, hello, good evening, everyone. Thank you for having me in this space. I am a board certified family medicine physician and also public health specialist. I'm currently with Mayo Clinic in Jacksonville, Florida. My clinical focus is full spectrum family medicine and hospital medicine, but I'm very passionate about maternal health. COVID-19 information and education is very important to me just because during my residency training, when the pandemic hit, it really brought an awareness that we never focused on, especially health inequities. And I think it's important to talk about that and how to offer better access to healthcare services. So thank you.
Thank you for being here. Dr. Matheson from St. Vincent's.
Hi, good evening, everyone. Thank you so much for having me. I'm Jeff Matheson. I am the Chief Medical Officer for Ascension St. Vincent's here in Jacksonville. I am also a board certified family medicine physician with 26 plus years of practice experience. And then I came down here in March of 2018 to assume the chief medical officer duties. I also get to precept our family medicine residents and medical students. So I really love that. And just like Dr. Katsuba, I am very passionate about education. I think that the more that we can learn and the more that we can impart information, the better off our community is. The better access that we can have, and we can really start to attack the disparities in access and the disparities in care, and ultimately save lives. And so far as COVID is concerned, I've really been following the numbers, and I'm kind of a numbers geek. So I do a lot of following the community prevalence and what that means in testing and all of that. So thank you again for having me.
Thank you so much for being here. Dr. Shalika from, I dare not try to pronounce your last name. I don't want to mess that up. So I'm going to introduce you as Dr. Shalika from Baptist Health. If you would please introduce yourself.
Hi, I am Shalika Katsuba. I am the System Director of Infectious Diseases at Baptist Health. I actually just joined the Baptist family in June. I'm very excited to be here. So I am an infectious disease specialist, and I went into infectious diseases because I'm really excited to fight the good fight against bacteria and viruses. And in that fight, the strongest weapon we have in our arsenal is vaccines. So I am passionate about the COVID vaccine and about getting all Americans vaccinated. Education is central to that. So I'm here to help debunk myths, to spread facts, and to get us all across that finish line to end this pandemic.
Great, thank you so much for being here. And lastly, Dr. Kim Barbell Johnson. I think I see you, Dr. Kim. Are you able to take yourself off of mute? There you are. Hello, Dr. Kim. If you will introduce yourself and tell us why COVID education is important to you. Are you able to hear me, Dr. Kim?
Can you hear me?
Yes, we can hear you now.
Thank you.
So we were asking everyone to introduce themselves and really tell us who you are and to talk about why COVID-19 education is important.
Thank you. And lots of technology issues here, but I'm glad to be with this Johnson. I am a family physician by training. I'm a graduate of the Mayo Clinic Family Medicine program, where I launched my family medicine career in Jacksonville, Florida, a couple decades ago, after which I joined the University of Florida's Family Medicine Residency Program, academic faculty, and later became a clinical researcher with a private company here in Jacksonville, Florida. As a at Care Partners Clinical Research, which is under the umbrella of Family Care Partners. I have been entrenched in the clinical research and clinical trial world for about a decade. COVID-19 and the SARS-CoV-2 virus has been something that I saw a great opportunity to use my expertise in this field and my comfort level in this field and my understanding of research to help with the educational needs. Then came the vaccines, which complicated things even more for the lay population and many of my patients, many of your patients, many of our friends and family. So I have basically spent the last year and a half doing all that I can in this community to just literally lend my passion and my expertise to sort through the facts of COVID-19. And I thank you for the opportunity to join this panel to continue to do the same.
So thank you, Dr. Barbell Johnson. And of course, a big thank you to all of you who have chosen to spend the next hour with us. We are so fortunate here in the Jacksonville community to have such amazing healthcare institutions here, and certainly to have all of you representing all of them here this evening. So we're going to just have a conversation. Everyone, of course, has been watching the numbers. Florida has been a hot spot for such a long time with the COVID-19 virus. And I think that things are sort of turning the corner right now. So we're going to just have a conversation. We've asked the participants if they have any questions to place those in the chat. So we'll have some conversation, and then towards the end, we'll have Q&A. We'll take conversations from the audience. I'll start off with the first question being, can the COVID vaccine give you the infection? And I know so many people, there's so many myths around our community, which causes for the COVID vaccine hesitancy in many communities, especially communities of color. But I want to start out with that question. And it may sound like a very simple question, but there are people who are afraid to get the vaccine for fear of getting the infection. So the way we'll do this, whoever wants to jump into that question, please feel free to do so.
Hey, this is Chad from UF Health Jacksonville. So I'll go ahead and kick things off. Just to rehash the question, can getting the COVID-19 vaccine cause COVID-19 infection? And the answer is no. It's oftentimes bantered about on social media or other places that, well, I got the vaccine and I got COVID-19. Or we've heard this for years with the flu vaccine. I got the flu vaccine and I got the flu. That's not how vaccines work. And especially the COVID-19 vaccine, the EUA or fully approved vaccines available here in the United States all induce immunity through mRNA or other technology, and they don't actually contain any live or dead virus. So when people become symptomatic after receiving the COVID-19 vaccine, that's really just your immune system reacting to the shot and building immunity, which is what it's intended to do.
So next question, anybody else want to tackle that or expand on that a bit? If not, we'll move to the next question, and that is, this is probably a question that a lot of people ask, especially women who are pregnant. If I want to get pregnant or if I am pregnant, should I get the vaccine?
Yeah, so I'll answer that question. Very important question, especially me as a family medicine physician. I really like to see, women who are interested in their reproductive health, and these are very concerning questions. So far, the two main organizations where, as physicians, we get our guidance regarding, the COVID vaccine and this, its effects with pregnancies, the American College of Obstetrics and Gynecology. There's also the Society for Maternal and Fetal Medicine. And so these two organizations really, since the pandemic, have been having several meetings, and really they've assessed all the information and the data, and also involved family medicine physicians in their decision-making. And really the recommendation is to still get the COVID vaccine, just because looking at the infection versus the vaccine, you will actually get more sick getting the infections. There are more complications to your body. There's even more complications to the birth itself. And so you are safer getting the vaccine so as to protect your pregnancy, if that makes sense. Even breastfeeding women are okay to get the vaccine as well. Case in point, during my training at the University of Minnesota, I had several of my colleagues, even co-residents, who were pregnant or if not breastfeeding, and they got vaccinated with no concerns. ACOG, or the American College of Obstetrics and Gynecology, they've been also following women who've been vaccinated, and so far nothing, at the moment right now, there hasn't been any concern or complications with getting the vaccine. But the infection itself, and I want to reiterate, I have actually seen my experience that pregnant women who are not vaccinated and who get the COVID infection have really very severe or several complications during the pregnancy. So I hope that answers that question.
Yeah, it does. But I wanted to just sort of expand on that a little bit. If a woman who is pregnant who gets the vaccine once she delivers the baby, is there any sort of additional protection? I know for breastfeeding women, during your breastfeeding time, to sort of monitor what you're drinking or eating. How does that transfer through breast milk, or will the baby have any particular immunities with the mom getting the vaccine?
Right, and that's an excellent question. I mean, theoretically, we assume that could happen because she has antibodies that could pass through, to the breast milk, to the baby, almost like, other infections the mother has had, and she has antibodies for that. Once again, this is something we're still learning more about, but I think at the end of the day, we're still recommending the vaccine because who knows, there could be that immunity which is transferred to the child. Especially right now, I know they're still trying to do some trials. The vaccine is not really available yet for newborns. And so I think if you're breastfeeding and you've received the vaccine, I mean, you're just even helping the child, I would think, theoretically. Yeah.
Thank you for that. Secondly, I know that we're all really excited that the booster has been approved. So give us a little bit more insight on the booster shot, who should get it, when they should get it, and just a little bit more information about it. I think we're all just so very eager to protect our communities, but there's still some fear in what the booster shot will do. So if anyone would like to tackle that question, tell us a little bit more about the booster.
Sure. So I'm first going to separate. So there's something called the additional or third dose and the booster. And so those are different. So just to define our words, the primary series, we consider the primary series the first and second Moderna, or the first and second Pfizer, or the initial Johnson & Johnson Janssen shot. So that's the primary series. So after that, individuals with a weakened immune system, so those are usually stem cell transplant, solid organ transplant, HIV, cancer patients, people who have a weakened immune system can get an additional dose 1 month after the initial series of Pfizer or Moderna. And the reason for this additional dose is because these individuals in the studies that we've done have not mounted an immune response after they got the first 2 doses or the primary series. So this is to get them over that, to get them that extra immunity. So the booster is different. The booster is given to individuals after a period of time because immunity, they did mount the immune response, but because that wanes. So right now, the booster was recently approved. So it's been approved for the mRNAs, the Moderna and the Pfizer, 6 months after the initial series, after the second dose. And that's in individuals who are 65 or older, in individuals with certain underlying medical conditions who are over 18, and in individuals over 18 who reside in long-term care facilities, and then in individuals over 18 who are at risk because of occupational or institutional exposure, so what they do or where they work. And that's 6 months after. And then for the Johnson & Johnson, that's a little bit different. There's no additional dose, but there is a booster dose, and that booster dose is in anybody who got that vaccine 2 months after. So that's what the boosters are. As I've already said, I'm a big advocate of the vaccine. So if you are eligible, you should certainly go out and get a booster dose. Studies have shown that, especially in certain groups, like in healthcare workers, this immunity wanes a little bit, and then we have variants, which decreases efficacy a little bit more. So that is a little bit of the scoop on boosters.
So do we know the percentage of people that are running out to get the booster shot? I know that early on in the vaccination cycle, there were people who were really trying to go wherever they could go to get the vaccine shot. So are people responding to the need to get a booster shot as they were initially? Do you see more of that?
Yes, we are. We are certainly seeing people who are getting both the additional dose and the boosters and running out and getting them. What we're facing, though, is that the same people who never got the initial primary series are not, obviously not getting boosters. And we still have, as of last week, only 57% of Americans were vaccinated. So we still do have a hole in individuals that we need to get vaccinated. And though these boosters are out, these boosters are actually not what will get us to herd immunity and not what will get us to end the pandemic. It's actually everybody getting an initial series. So it's getting as many unvaccinated people vaccinated as possible.
So you said 57% of people are vaccinated. Is that across the country, or
That's
is that
across the country, and that's both doses? The number of people who have gotten, the percentage who have gotten 1 dose is in the 60th percentile.
wow?
And
So what are we looking at in Jacksonville? And I know Dr. Kim Barbell Johnson, you could probably weigh in on that for sure.
Yeah. So in Jacksonville, we're still struggling. We are just shy of the state average for vaccination by statistics. But I think the takeaway point really is that while we have had authority to give 3rd doses for the immunocompromised and booster shots for those who are qualified in the United States, primary vaccination, both dose for the mRNA vaccines and 1 dose for the adenovirus vector, the Johnson & Johnson virus, 2 weeks after vaccination for complete vaccination, is still an incredible milestone that we must reach. So we want the boosters. We're looking at essentially those who were immunized early, or those who have significant occupational or health conditions that suggest that they should actually have that extra boost right now. And that group will probably be expanded by the ACIP with time. However, there's still an incredible need for us to keep the gas, our foot on the pedal when it comes to primary immunization. And so while we can follow the statistics, it is that we are still shy of where we need to be. And we're still with an incredible need to continue to look at those who are most at risk, and to continue to help them to not only overcome vaccine hesitancy, but to really fill that gap where their education where education is needed. COVID COVID has uncovered and unlayered many things regarding research and vaccines and the purpose of vaccines and how we respond to chronic health conditions. And this is a real great opportunity for us to do all of the above. But during this pandemic, which is, well, our numbers in Florida has gone down. We are in Jacksonville, Florida, very blessed to have, single digit new case numbers right now. But if we look across the Atlantic, we are seeing communities with double-digit rise in COVID, and we cannot take our eye off the prize. So boosters are important, but we still need to reach those who have not been vaccinated and continue to get those who are qualified for vaccinations in this new group of kids 5 to 11 years of age. We must continue to work with those families to get them the education that they need to overcome any degree of uncertainty or information lack that they may have.
Thank you so much, Dr. Barbell Johnson. And you are right on key with all of that. And part of the Communities for Immunity initiative is really just about what you are speaking of. It's really educating our population of people. Now, I will say that although we have opportunities like this, these panel discussions, how do we reach the people that we really, really need to reach? We tend to find that we offer these kinds of educational opportunities, but in many instances, we're not really reaching the people that are hesitant for the COVID vaccination. So if any of you have any strategy or places that we need to be able to provide this kind of education, we certainly are willing to do that with not only the Cummer Museum, but there are several community organizations that are in our community who are really trying to reach the people that we really need to reach so that we can get rid of this virus and be able to get back to a semblance of normalcy, if you will. So if any of you can share any of that with me, we're certainly able to try to get out there to get, I know that's $1 million question and maybe no one really has an answer, but we have to continue to keep working at it. So I do have another question from one of our audience members, and it is, should individuals get the annual flu vaccine or only get the booster? Dr. Matheson, would you like to take that one?
Certainly. So I presume the booster is related to the COVID, where rather than the flu vaccine booster. But the answer to that question is a resounding: you need both. You absolutely need both. It's interesting. I laughingly, people ask me, so what's the separation between the COVID vaccine and the flu vaccine? And I say, oh, maybe like a centimeter or so. They only need to be separated to be funny about it. But actually, you can get them at the same time. There is no reason to not get both of them. And I am passionate, as are all of my panelist colleagues here. It is so important for us to be vaccinated both with the COVID-19 vaccine and the flu vaccine. We were really blessed last year because of all of the social distancing and the masking and everything, that we had a very mild flu season last year. But we cannot bank on that every year. So we really need to keep our immunity high with both the influenza vaccine and the COVID vaccine.
Awesome. Thank you so much, Dr. Matheson. Another question from our audience is, what is community mitigation? Does anybody want to take that?
Yeah, I certainly can. This is Chad. So when we use terms like community mitigation, what we're really talking about are things like masking, social distancing, and effective public health measures in public to help control the spread of disease. So when Dr. Matheson was talking about last season and why we didn't see a lot of flu, it's largely because for the first time really ever in modern history, we had Americans widely wearing masks and social distancing, and this was enforced by businesses or some state governments. And so that effectively limited the spread of not only COVID, but flu. So there's a lot of different types of these community mitigation strategies, but we really mean things like social distancing and masking.
Great, thank you. Thank you for that. Go ahead.
Sorry, I'd just like to add that, as we talk about community mitigation, the first word is community. And while we are talking about a pandemic, it's important to recognize that all communities are not created equal, right? So while we may look at the percentage of vaccinations in, say, St. Johns County, our neighboring county, and Duval County across the board, there are things within a community that makes risk different among the citizens of that community. How closely those residents of that community live, for example, the ethnic and social diversity of those communities, of those counties, another example, the degree of the burden of chronic disease in a community. So while you may hear things like it's important to social distance, yes, those are important things across the board, respiratory hygiene, hand hygiene, immunization, but certain communities, it's even more critical that we are observant and passionate about observing the things that we can do as a group, and also look at the things that make us more at risk for COVID-19 complications, which includes, unfortunately, ethnic diversity and the burden of chronic disease and those other things. So COVID meets you where you are. And as we look at mitigating COVID in a community, we must look beyond vaccination and hand hygiene. We must also look at how do we make that population healthier as a group of healthcare professionals and healthcare advocates so that we can truly mitigate the risk, not only for COVID-19, but for the other pandemics that are to come.
If I can also, yeah, thank you. Yeah, and just to sort of piggyback on that one, and I think Dr. Barbell Johnson was hinting, if not alluding to, the health inequities that we've seen exist in different communities as well. And through this pandemic, of course, it's brought into light that, whenever we do health education, especially the public health specialist in me feels that, okay, I need to do a needs assessment because each community is different. They have different needs. Some of the challenges that certain communities face, as we know, there's a lot of historical policies which have impacted where people live, their access to food, their access to schools, their access to hospitals. And so if really we're going to try to find answers, and I tell people really the answers to understanding sort of these health inequities is we have to also understand the history and the policies and how do we change these policies. So there's an aspect of also political will, getting involved really with even your town hall and, talking to them and say, what are you doing for our community, our neighborhood? What funds do we have to access these resources so that we can be part of this movement to, become healthier? And so it goes back to the question you were mentioning, Ms. Willis, is that, I think about in Colorado, they have a really good example of how they kind of dealt with health disparities in different communities. Specifically, they created an initiative whereby they literally just had a bus or a small vehicle and they went to, different communities and did outreach. Yes, it's risky because it's in the middle of a pandemic, but they had to make sure that they had masks and whatnot. On a personal note, I'm from Uganda, East Africa. That's where I grew up. And I remember, with working in the health field, because I worked there before coming to the US, we would educate our patients underneath the mango tree, or we would go to them. And that's how I see primary care or family medicine in its essence, that essentially we need strategies where we can't be sitting in our IV towers or sitting in clinic waiting for the patient to come, but we have to find strategies on how do we go there? How do we talk to them underneath the mango tree? How do we figure out the strategies that are relevant to them based on their history? So ongoing conversation, but something that needs to be acknowledged. Thank you.
Absolutely.
And just to expand upon that a little bit more, what you both were saying about different communities and really just trying to establish a level of trust. I know in many communities, although you can go into communities, if the community doesn't trust you and trust the process, it's still very difficult to kind of get that message across, which is one of the reasons that this initiative, Communities for Immunity, was sort of born out of the need for becoming a trusted partner in the community, really caring about your community and the health and well-being of your community. So there are initiatives out there, but it is, of course, as you all will know, it's a very difficult situation to really try to gain the trust of various communities. And that, I feel, is one of the ways that we can kind of eliminate some of the health disparities and being able to be out in the community.
Well, a little bit of a topic, Wanda. We all know that people don't care how much you know until they know how much you care. And one of the things that we have failed to do historically is really kind of care for our patients. We talk a lot about healthcare and healthcare outcomes, but we need to care first. We need to care about the people, and we need to be intentional about how we are showing and honoring our promises to communities that are now not trusting because they have historical reasons not to trust us. So just because the science is in place, just because I understand the science and you understand the science, does not give us, carte blanche with certain communities. We have a lot of work that we still need to do, and we've learned that if we do the hard work first, the easy work will come. But we're still challenged to do the hard work. It's easy to put posters up. It's easy to ask for masks. It's easy to make mandates sometimes, but we still have the hard work to do as a community. And so where you ask, what can our communities do? What can partners like the Comer and those who you partner with, what can we do? We must continue to do the hard work. It's pretty fundamental. And I think that it's great that we have all the partners that you do representing the institutions that are represented on this panel, because we are all in this. But how do we translate that message to the people in the grocery stores and the people in our churches and synagogues? It's one person at a time. And it's really just kind of showing up, caring, listening without judgment, understanding their concerns and providing that information. It's frustrating because I think I've done everything but stand upside down to share the merits of the COVID vaccine, or to share, as my colleagues have, where the science is as a scientist who does vaccine research. And it's important that the facts are shared and that disinformation is sorted out. But first, people don't care that I have a Mayo education, a residency certificate on the wall. They don't care that I've got 3 degrees. What they want to know is, do I care about them? And I think that we must continue to recognize, how do we show that we care about our community? How do we treat them when it's not COVID? How do we talk to them when we're not talking about the pandemic? And I think that once we continue to do that, once we continue to be part of their conversations about health and wellness and the education of their children and the economy of their neighborhoods, then I think we get the trust. It's a big chasm if we think we're just going to start at A and end up at Z through this conversation just through the pandemic. So I just needed that.
Thank you for sharing that, Dr. Barbell Johnson. We are certainly, we're at the beginning of this, and this is really just the beginning of where we need to start to become trusted partners in our community. I do have a few more questions from our audience, and the next one is, can people who receive the J&J shot receive a Moderna or Pfizer booster?
So I can take this one. So yes, if you get the, this is actually the mix and match concept. So it's also called heterologous boosting. So what that means is, if you got J&J 2 months afterwards, you could get a booster with Moderna, or you can get a booster with Pfizer. Similarly, if you got either the Pfizer or the Moderna, you can get whatever you want as a booster 6 months afterwards.
Okay, great. Another question just came through from Connie Sambrone in Atlanta. And the question is, why is it necessary to wait 6 weeks after a booster to have a mammogram? And
I can take.
that's a new question to me. So Dr. Matheson?
I can take that if you'd like. The immune system, when it fires up with mounting the immune response that the vaccine is supposed to create, sometimes the lymph nodes in the general area of where the vaccine has been administered, which is in the deltoid muscle in either arm. So sometimes, only sometimes, there can be some swelling of the lymph nodes in the underarm area. And so it's just a precaution, because if a woman were to get a mammogram and have that swelling of the lymph node within the first 6 weeks of the vaccine, it may cause a lot of consternation and fear and additional testing that would need to be done simply because she had a swollen lymph node from the vaccine. So that's why we recommend that you wait for 6 weeks. Now, and it's really only a recommendation if it doesn't adversely affect your health. So if it's more important for certain patients to actually get the vaccine, and we'll worry about the lymph node swelling, but we just don't want you getting COVID. Certainly, not everyone has to wait, but that's the general reason why we say it's probably reasonable to wait 6 weeks.
That's great information. I didn't know that, and I'm glad you shared that with us. So thank you for that, Dr. Matheson. Another question from our audience is, as we all know, we're about to embark upon the holidays and people are getting excited to finally travel to see family and things like that. So there's a question, is it safe to travel via airlines to Asia or India? Anybody want to tackle that one?
Yeah. Dr. Barbell Johnson, you want to start?
I'll start. Safety is relative. So, the airline industry has been very good about doing everything that they can to protect the employees of the airline industry and the passengers in the airline industry. The filtration systems in the airlines have been world class, and those are the things that actually have made traveling in an airplane relatively safe, particularly with the continued masking within close proximity on the plane. However, the CDC has been keeping up with the incidence of COVID in communities. And so on the CDC website, there is information that's constantly updated about places that you may want to travel. And they're kind of red light, green light, yellow light in terms of how dangerous is it based on the percentage of COVID or the incidence of COVID in that community. So I think it's important to recognize that the traveling part and where you're going part. We've seen a lot of social media posts of people in Mexico and living the time of their lives, and with the traveling opportunities, because we've just gotten kind of like cabin fever over the last year and a half. It's important that we just make sure that we are following the recommendations, that we're wise, that we're following the recommendations of the CDC and of the World Health Organization, because I know that there are international members on this call, and that we're cautious and careful when we travel back to the United States, when we re-enter into our communities, because it is important that we are following those to decrease the spread, especially of asymptomatic COVID once we return, or even to get to other communities.
To add on to that, I get asked this all the time: what is it safe to do when, over the holidays, where is it safe to go? So there's not one individual answer that I can give you, which is what makes it so hard. So there's not one cookie cutter explanation. It's really assessing your individual risk also. So if you're immunocompromised, or if you have a child who's unvaccinated but maybe vaccinated soon, it's different than if you're young and healthy and have been vaccinated. And so it's really assessing your individual risk as well, in terms of how many people you gather with, how close you are in terms of settings for Christmas and Thanksgiving. And then when it comes to international travel, it is very much the same. So as Dr. Barbell Johnson said, please go on the CDC, and there's a list of countries. It just explains to you what countries are safe for travel, what countries we consider high risk for travel. And so look into that when you make decisions about where to travel. When you fly on the plane, there are ways to minimize your risk, including wearing the mask and social distancing. And so if you do decide to travel and that it's worth the risk, or that you really want to go, then by all means follow as many safety precautions as you can when you go.
And I think maybe just to add on, important thing is also go to the country's like website. Sometimes they have like a Department of Health or Ministry of Health or whatnot. Make sure you also follow their country guidelines, because you may want to travel and then you reach their customs and they're like, no. And so CDC tries its best to update the information, but I've just had patient stories telling me, oh, they got stuck somewhere in some country. So be mindful of that. Especially if you've yet to get vaccinated. There are some countries who will refuse entry if you're not vaccinated. So you need to be very respectful and mindful about that, just because they may have limited resources and they're just still trying to handle the pandemic themselves. So go to the country's website as well, find their official government, Ministry of Health or Department of Health, and see what their guidance is as well. Yeah, that's it.
Great answers. So there are a couple more questions about the infection that, of course, are still important, not just the vaccine. One of them is about when should you seek emergency care if you are sick with COVID, and how do you handle those symptoms? How do you know that you may have COVID?
I can answer that too. With COVID, the characteristic, sort of clinical symptoms is that shortness of breath. Some people say, or I lost the sense of taste or smell. But there's some people really that shortness of breath becomes like too much that they can't even walk or they can't even move. Like and they will even tell you, I've never been short of breath. I feel like I'm suffocating. Especially if you're unwell, and we're also in the flu season, I still encourage you to seek immediate attention. I would not want you to delay. I remember during the early days of the pandemic, especially when we didn't really know what was happening, it was sad that, for a person my age, I've seen too much death than I needed to. There are some people who came and then within 24 hours, they were gone. Because they thought, oh, it's a flu, it's just a flu, it's a cough, and they ignored it and they sat on it. And so by the time they came, they were so far gone that it was really hard to, we did what we could, but it was just too hard to help with their respiratory effort. And so I always, tell individuals, of course, your body and you know how it behaves. And if you feel something is off, you'd rather go get a visit, let somebody assess you, especially at urgent care. If you have time, you can go to the clinic. And then, we can hopefully try to help you and decide if you need specialized hospital care or is this something to watch and wait. Because we'd like to think patients follow textbooks, but they don't. And of course, we've learned that as physicians, patients are not textbooks. Everybody's body is unique and different. For me, I personally get worried when somebody has other chronic issues like diabetes or hypertension or COPD, which is chronic obstructive pulmonary disease. Then for me, my threshold goes up to like admitting them, because I'm so worried that they can change in a span of 12 hours. But listen to your body, go see someone, seek medical attention as soon as possible, because everyone presents really in a different way, and we would have to see you to assess you. Yeah.
And I think that while all communities don't have the same resources, there are communities with monoclonal antibodies that are available, and the protocols for those are different in many communities, but they were authorized by the FDA to be used for those who have been exposed or those who are early positive actually, at this point in our community, all you need is exposure to COVID or the report of exposure to COVID to get monoclonal antibodies. And they're not therapeutic agents, but to decrease the burden of disease, to decrease the chance of entering the hospital, becoming ventilated in the hospital, or having a serious outcome from COVID-19. Those are the kinds of things that you can look up in your community, particularly here in Jacksonville, to see if those opportunities are available for you. Using telemedicine to report your symptoms, getting remote testing if that's possible, or using some of the home test opportunities that we have in the BioNext Now and the other types of home tests that are relatively accurate particularly with the symptomatic patient. And the asymptomatic patient, the numbers go down a little, but I think that we can actually try to, as we do with other things, primary care, as soon as, like my sister colleague said, you feel that there's a difference, don't say, well, it's probably my allergies. Don't say, well, it's probably I was exposed to whatever. Think COVID, because if you don't think it, you're not going to diagnose it. And because we have seen every variation of this disease escalating, and right now, to tell you the truth, because it is really a disease of the unvaccinated, this is even more to the unvaccinated population, while the vaccinated is still germane, but especially if you are not vaccinated. One, get vaccinated, but two, if you are symptomatic, I'm more worried about you in this space, because right now in the last 100 days, what we've seen is a difference than the first 100 days of this pandemic. And what we're seeing is this disease is affecting those who are more white, more rural, and more young. So as compared to the pandemic in the beginning. So this is a disease that's not a discerner of a lot of different demographics. In the year and a half that we've been managing this, we've seen everyone affected. And right now we're really most concerned about the unvaccinated. But to answer the question, as has been said, should you actually think that it's COVID or have a change in your baseline health, get tested, report that to your medical team, discuss it with your medical home, seek medical care as soon as possible. It's hard to get into emergency rooms. We know when urgent cares, we don't want to send you there, just willy-nilly, but better safe than sorry in this situation.
Great. Thank you so much. Well, we are about to come to the end of our discussion, but I would like to give each of you a moment for some closing thoughts as we sort of wrap up this conversation, and just to thank all of you for participating on our panel discussion this evening. And as a reminder, at the Comer Museum of Art and Gardens on Saturday, November 6th, we will be offering COVID vaccination. We are partnering with Agape Health Center and JTA Mobile Wellness Bus. They will be on site on Saturday for both Pfizer and Moderna vaccinations. So please share that with any of your network. But before we close out, I'd like for each of you to take a couple of minutes to give some closing thoughts to our audience. We'll start with you, Chad.
Yeah, and again, thank you for having me here tonight. So I think a lot of medical and healthcare providers over the last 19 or so months have taken away a better sense of resiliency, particularly our young physician providers who have gone through their residencies or their training programs. And so I think resiliency is really important, not only in our healthcare and medical field, but also in our communities. And I think what you're seeing, and I'm going to approach this from a different angle of not just wearing masks and getting vaccinated, but really taking care of each other. Kindness really goes a long way in our communities. And as others have said during this call, a sense of caring for each other really does help bridge that gap for understanding for people, whether it comes to explaining our positions on vaccines or masking or whatnot. It all is rooted in kindness and the ability for us to bounce back and be resilient in the face of this pandemic. And we're all tired. I think that we really appreciate any community outpouring that we've seen in our hospital systems to support us. But we know too, the general community is tired. And so take care of yourselves. And I really plead that everybody give themselves a pat on the back and understand that, yes, we've been through a lot as healthcare providers, but so is the community. And we want everybody to be kind, take care of each other, and build that resiliency, because we're all going to be better for it in the future.
Thank you, Chad. Next, Dr. Shalika.
All right, so I feel like I answered a lot of questions about the booster, so I'm just gonna throw this plug in. People ask me all the time, do the presence of boosters mean that the vaccine is not working? The vaccines, the primary series, are working to prevent severe illness and death. So please don't think that boosters being out there mean that the vaccines, the primary series, don't work. They do work very well to prevent severe disease and death. And then I saw a question, so I'm just going to briefly say the vaccines are very, very safe. So we have tons of efficacy and safety data, so please consider that. And then we've talked about perhaps historic mistakes in terms of certain communities and different communities in our history, but because of those mistakes, now we've tested this vaccine in many different demographics, so it's not enough to just go after one population. These clinical studies are in, women and people of different colors and races, so please consider that as well. So I urge you all to get vaccinated. And if you have questions, please reach out, because we are all here to help you. And then I couldn't echo what Chad what he said about kindness and compassion. And that's why we're all here. So the only way out is together. So that's what I've got.
Thank you so much. Dr. Matheson.
Well, I would just like to echo my thanks for inviting me to be here tonight. What an incredible group of panelists. Thank you so much. You are amazing. And the thing that I just would like to say is we absolutely have to extend grace over grief, always. Grace before grief, because we need to love on each other. We need to love on people. As Dr. Barbell Johnson said, they don't care what we know until they know how much we care. So we have got to love on people. That's the only way that we're gonna get this done. And as we do that, and as we disseminate the truthful information, we all then can become vaccine ambassadors. So you don't have to have a degree after your name. If you have heard us, you can say what you heard us say and become a vaccine evangelist.
Thank you, Dr. Matheson. Dr. Ramala.
Yes, once again, thank you for having me in this space. I'm very humbled. You can hear me well, right? Just checking. Okay, good. So like everyone said, yes, grace, just resilience. We've been through really a tough couple of months. I know a lot of people always wonder, when are we going to get back to the normal? I'll be honest, I don't want to go back to the normal, because I feel this is the new normal that we should be actually happy to embrace. We've gone through things we never imagined, but I'm sure somehow or other each of us have become a new version of ourselves that hopefully is for the better. So let's try to embrace that. Just note that there are people like all of us here, we're fighting the good fight. We're also, we acknowledge you have concerns. I acknowledge patients who have some hesitancy and, their concerns. So we acknowledge your feelings. And just know we are working on health equity issues, because that's also another important aspect. I know I'm very passionate to how to improve access to everyone, and also how do we tackle those historical policies that have impacted our situation right now. And so just know we're doing that. We're here for you. Feel free to reach out to me personally. I'm okay with somebody trying to reach out to me. I'm on Twitter. I don't know if you're on Twitter. I like to answer questions on Twitter about COVID. So I'll put my Twitter handle on the chat. But thank you for this space, and be well.
Thank you. Thank you. And we'll wrap it up with Dr. Barbell Johnson. A few words, parting words.
Thank you. I know the closing hours near, so I'll try to be quick, but I am so very proud to be a member of this greater Jacksonville community and to have leaders like you, Wanda Willis, engaging the community. A museum talking about health, talk about the best of all worlds. So thank you. Thank you to the Comer and to your partners. Thank you to my colleagues who thought it not robbery to spend the evening after a long day of work on this call, because, as we talk about these numbers, like 500,000 people with a disease or death, or 1/4 billion people having COVID, and the numbers seem staggering, but, I just buried my dad 3 weeks. Well, my dad just died 3 weeks ago. I just buried him a week ago. And, it was just one dad. And it's that one dad was all that I, had. So all of these families who have lost just one dad or one mom or one grandma, and particularly those deaths that were preventable. That's why I'm here. I'm here trying to help to decrease the number of preventable death across the family medicine spectrum, but tonight, because of COVID-19. And as a scientist, I would be remiss to say that for those who are still on the fence about this mRNA thing, this is a platform that not only is it here to stay, but it is here not only in the vaccine space for immunologic things for infectious disease, but be encouraged. I did a very quick search right before signing on today, just to let you know that there are active, enrolling, recruiting studies using this very same platform across the world for esophageal cancer, ovarian cancer, rabies in Germany and Belgium, Zika, melanomas, CMV, metapneumonia, and prostate cancer. Those are the studies that you can go on clinicaltrials.gov right now and enroll in a study if you qualified and were in those communities using this mRNA vaccine. For those who are hesitant, we don't get to this place in medicine willy-nilly. These studies are now able to move forward because of what we've learned during this pandemic and what we've learned and added upon our body of knowledge. So trust the science, yes. We're not all scientists. Trust those who know the science, yes. Reach out to those of us who are available to you and continue to partner with each other as you fill in the gaps for family members and friends. I'm happy to be a continued member of this community who's continuing to care. And thank you so much again for the invitation.
Wow. Well, thank you to all of you from the Comer Museum of Art and Gardens. And you all have been on the front lines through this entire process. And we are so grateful to have these amazing healthcare institutions here in our own community to help us get through this pandemic. But I would also like to invite you to come and take a moment at the Comer Museum. Our gardens are a perfect place to really just enjoy a little peace. And I know that all of you deserve all of that with the hard work that you are doing to keep our community safe. So again, I thank you for joining us this evening, and we will look forward to seeing you soon at the Comer. Thank you and good night.
Thank you.
Thank you.